Susan Collins saved Obamacare. Now Maine families pay the price. In 2017, a single Senate vote saved Obamacare, and it came from Maine's own Republican Senator Susan Collins. Today, families across Maine are still suffering the consequences. Rising health insurance costs are crushing Maine families, said Bill Clarke, U.S. Senate candidate for Maine. It's Susan Collins' fault. Because of her vote, state employees now pay over $10,000 a year for family insurance. City workers in Portland pay similar amounts, and part-time employees, including moms with young children, are stuck with premiums over $20,000 a year. And the problem isn't limited to Maine. Clarke highlights similar situations in other states. In Wisconsin, a family PPO plan for a state employee cost over $56,000 annually for a retiring couple. If a state worker becomes too sick to work, they lose the taxpayer's assistance and must pay the full premium. With COBRA, that increases to over $57,000 a year, even for cancer patients. Dr. Teresa Graham, president of North Florida Right to Life, and a certified child health advocate, is part of Clarke's health policy team. She warns, America is facing a health insurance cost crisis that the media refuses to cover. Obamacare was sold with the promise of saving families $2,500 a year. Instead, it has become a system of overpriced, low-quality HMOs. She points to shocking examples. In Broward County, Florida, a school employee adding 2 children to the Aetna HMO pays $2,119 a month. In Portland, Maine, the lowest-cost Obamacare Bronze HMO for a child is $324 a month with an $8,000 deductible. In Florida, a child's PPO plan costs $617 a month with a $10,600 deductible. These Affordable Care Act, ACA HMOs, have narrow networks and pay nothing out of network. Americans are tired of paying high prices for weak coverage, said Dr. Graham. But there is a better path forward. Clarke supports the Trump-backed American Health Care Act, which Collins derailed. His campaign has brought in insurance expert Lee Benham, Lee's book, The Great American Healthcare Scam Advocates, for a voluntary age-based tax credit model that puts consumers, not employers or bureaucrats, in control. Under this plan, every American receives a tax credit based on age, Benham explained. For example, a 30-year-old couple with 2 kids in Portland would receive a $12,000 annual subsidy. A free market, zero-deductible plan would cost the family $551 per month or $6,612 per year, meaning the remaining $5,788 goes straight into their health savings account. Because Maine has some of the lowest premiums in the country, families benefit with more of the credit going toward long-term tax-free savings. This is how we fix and how we finance health care, said Clarke. I support real reform. Replacing third-party bureaucracy with personal ownership, Americans deserve better than overpriced employer-controlled insurance and broken government promises. Clarke, who had an insurance license, says most Republican senators failed to support Trump on health care. I won't make that mistake. I'll fight to give families choices, lower costs, and financial freedom through America First reform. This bipartisan, consumer-driven solution ends the hidden tax of employer insurance and puts families first. For more information, visit www.billclarke.us or call the Allstate Zero Deductible Quote Line at 1-844-866-1776. Clarke informs, in addition to age-based tax credits, America First reform includes tax-free health savings accounts, HSAs, for all Americans regardless of their insurance deductible. Also included are larger HSA annual deposits of $10,000 for singles and $20,000 for families. The catch-up amount for those 55 and older increases by $5,000 annually. Bill Clarke believes America First reform turns high premiums and taxes into assets for American families. Media contact, press, 207-555-0241. Paid for by Bill Clarke for Senate.